Education, infrastructure, tax breaks. Governor Little checking all the boxes in his State of the State address today. But there's a big box of cash known as the nearly $2 billion surplus. How should we divvy that up?
Let's go, Brandon.
The chant has become a closing line to speeches, for one Idaho congressman anyway. He said it, but now apparently not bragging about it. After weeks of operating under crisis standards of care, the COVID crisis seems to be waning in Idaho. Not so much from the healthcare perspective. We're checking back in with St. Alphonsus critical care experts about what they expect over the next few weeks. Well, they're back. After a short time away, lawmakers now back in Boise and ready to take on the 2022 legislative session. Today, first step of that, well, who knows how long of a journey. As is tradition, Idaho Governor Brad Little kicked off the year with his proposed roadmap of sorts in his State of the State address, things he'd like to see happen. Little laid out several big ideas in his new Leading Idaho agenda. Of course, everything Little said during his roughly 30-minute speech today, just a proposal. It's now up to Idaho lawmakers to take action, or not, as the case may be. Joe Paris is following the legislature for us this session. He joins us in studio. Joe, how receptive are lawmakers to what Governor Little said today?
Interestingly enough, Brian, so far they seem pretty receptive, but there are certainly some questions. Governor Little laid out some major investments, millions and millions for education and infrastructure, for example. But the governor also wanted to cut taxes again and return money to Idahoans with such a big surplus, similar to what we saw last year with the tax rebate legislation that passed. Now, this session, though, that growing surplus, it's expected to generate some big ideas and big conversations. Lots of money. Endless way to spend nearly $2 billion. Now, House Speaker Scott Bedke had this to say about the opportunity that the budget surplus presents Idaho shortly after Little spoke this afternoon.
You know, of course, we have always preached that it's not going to be the bad years that put you out of business. It's going to be the good years. We are on the cusp of a very, very good year. We've got to be careful that we don't create government programs this year that we cannot keep up with when the wheel turns. Now, having said that, I didn't hear things that made me overly concerned today. I think that all of the investments that he's talking about, I think those will be structurally balanced, and that we won't be using one-time money for ongoing things. He'll plug one-time money in prudently into some of our deficits in our transportation system. I think that's good.
So a pretty big endorsement from Idaho Republicans today. For the most part, thumbs up to what the governor said. Some Republicans tell me, though, they want some more details. Now, I also spoke with Idaho Democrats today who say they do appreciate some of Governor Little's ideas, but they're interested in more details. Specifically, how investments from the budget surplus are making it into things like education, transportation, infrastructure, etc. You can invest in these things, but Democrats want to know how specifically. Now, Idaho Democrats are also making another point on the surplus debate. They say that budget surplus that we have right now was actually created by poor politics and policies over the years. House Minority Leader, Democrat Alana Rubel, explains their point of view.
I want to correct the notion of a budget surplus that the governor referenced. This money was generated by systematically underfunding vital services. Now, the governor suggested we look at the state budget much as we would look at a household budget. Now, if you haven't paid your mortgage or your utility bills, you may appear to have a lot of money in your checking account. But you would not call that a true surplus, or you certainly wouldn't call it a sign of responsible management. And that's exactly what's happening here. Idaho has a lot of money in the bank account right now, but it's in large part due to irresponsible decision-making by politicians, where children and working families have been left to pay the price. We remain last in per pupil education investment in America, as you've heard. We are still one of only 4 states in America with no early childhood education.
So there'll be a lot of back and forth on the budget surplus over the next several weeks and months. It'll be interesting to see how that conversation shakes out. But another item I wanted to touch on real quickly here, property tax relief. Every lawmaker I spoke with today at the State House, they say they know that property taxes are top of mind for Idahoans. And I was given a general idea from lawmakers on what that conversation could look like this year. It seems like this is really going to come down to the legislature leadership and the lawmakers working with local governments across the state. Now, that communication between those parties last year, it did get a little bit messy from time to time, but there was some property tax legislation passed in the end. But Brian, speaking with really some of the major players on that debate from last year, they tell me this morning they know there's work to be done. Yep. It's going to take time for the wheels to get rolling, but they know it's there and they will address it.
Yeah, because nobody was really thrilled about that property tax legislation they passed last year. So it's going to take some serious, looking into and kind of figure out what worked and what didn't. A lot of it didn't for a lot of people. All right, Joe. So we have this list of things that seem to be important. I mean, somebody said it this morning. This is a to-do list that has been around for decades. We've always been told up to this point, too, well, that's our rainy day fund. We don't want to really dip into that too much. We also talked a little bit, or the governor said he wants to be cautious in how he spends this. Almost $2 billion.
Yeah.
Where are we going to start to see some of this go out to where this decades-long to-do list has been asking for it?
That's going to be a great question, Brian, and really I do think that's going to be the storyline of this legislative session because we have almost $2 billion in surplus, meaning there's millions and millions of dollars that could be put into one-time investments like roads and bridges and water infrastructure. Speaking with Scott Betke earlier today, the speaker said we know that there are some major bridges and some major infrastructure projects across the state that have had to wait for several years until we got the funds. Well, now the funds are here, Brian, so it'll be really interesting to see what projects are selected because there is a lot of money, but you can only do so much with it. And at the end of the day, it's all also going to be how do the lawmakers agree on splitting it up?
Top thing on Governor Little's budget highlights list, accelerating implementation of the career ladder, representing a 10% increase in pay for Idaho teachers.
Yeah.
See how that works.
Education will be big. We'll leave it there for now.
All right. Thank you very much, Joe. You know, every year, the Saturday before the State of the State address, there's the annual Governor's Dinner and Ball. And this year, like so many before, it was hosted by the Idaho Republican Party, which means you can count on there being a who's who of Idaho's Republican politicians in attendance. This year, no exception. Here's a picture of 3 of Idaho's congressional delegation with 2 governors. There's Senators Jim Risch and Mike Crapo, former Governor Butch Otter, and of course, Governor Brad Little, and then there's Congressman Mike Simpson, who posted this picture to his campaign social media accounts. And he said he had a great evening at the 2022 Governor's Dinner. But Congressman Simpson also posted something else from the Governor's Dinner, a video of a speech he gave. Take a listen, especially to how he ended it.
We have a common goal, and that's to enact policies in our local communities, in our state, and at the federal level. And never forget our pride. Let's go, Brandon.
Let's go, Brandon, received by a round of laughter and applause. And for those unfamiliar with the phrase, it goes back to a NASCAR race in Alabama last October. A driver, Brandon Brown, was being interviewed after the race. The crowd began chanting behind him, and it was a bit muffled at first, but the reporter suggested, because she couldn't hear very well, they were saying something like, "Let's go, Brandon," since, well, it was Brandon being interviewed, right? As the conversation went on, however, it became clear they weren't saying, "Let's go, Brandon," but 4-letter expletive Joe Biden, as in, "Let's go, Brandon," that kind of thing. Well, since that day, "Let's go, Brandon" has become the cleaned up slang for the vulgar version of that phrase. And something you usually hear from those who said the same thing about your feelings for 4 years. Remember that? But this wasn't your Uncle Wayno standing around the bonfire in your backyard who just threw this out there. This was an elder statesman from Idaho. Playing to the crowd? For sure. I mean, it is an election year after all. And it wasn't a private moment caught on camera. Congressman Simpson posted it himself to his campaign page. And if he didn't, somebody he employed did. But then it was deleted. Not before it was seen by a lot of people, several of whom expressed their dismay directly to the congressman on Twitter. Like this viewer who asked us, can the 208 get a statement from Representative Simpson about this? Well, we tried. We reached out to Congressman Simpson and his campaign, and we have yet to hear back. An elected official using the phrase, "Let's go, Brandon," to cap off a dinner speech. Are we being too sensitive? Congressman Simpson has preached bipartisan legislation in the past, a lot of times. Is this paving the way for that? And if this is really how you feel, Mr. Simpson, why'd you take down the video? Those are all questions we would love to have answered by Congressman Simpson or his campaign. One more question we'd like to ask, too. How low is too low for a congressman to reach for attention? We've gone from rationing care back to somewhat normal in Idaho's hospitals, but Omicron has thrown that optimism for a loop. We're back at St. Alphonsus to see what has and hasn't changed since the state deactivated crisis standards of care. You know, one thing that hasn't changed here, we still want to hear from you. Grab your phone and send us a text message. Maybe you have a question about the legislature or a comment about COVID. Text it to us directly, 208-321-5614. That is the number, and we want to see your name and the hashtag the 208 attached to that. But a word of warning, we may share yours at the end of the show.
Minutes away with its military menacing neighboring Ukraine, Russian officials in high-stakes talk with U.S. diplomats.
See something new.
The rest of the United States is being overrun by Omicron. According to the Wall Street Journal, the 7-day average of newly reported COVID-19 infections is about to triple the pre-Omicron record set last year. That was when the U.S. was reporting 250,000 cases a day. Here in Idaho, we're spiking too, or at least starting to. We've more than doubled our 14-day average from less than 400 a day to more than 800. We've gone from a statewide positivity rate of 5.5% 3 weeks ago to 17.1%. And COVID cases are one thing, positive cases. It's when those translate into hospitalizations is what worries and what will burden our healthcare systems, a trend we are already seeing. Let's take St. Alphonsus Regional Medical Center. Positivity rate there, 28.6. It was 8% a week ago. That's just testing within their health system. They tell us last Thursday they had just 23 COVID patients in their entire health system. By Friday, it had more than doubled. Today, it is up to 79 COVID patients out of the 400 in the hospital across all of their facilities. 28% of the patients in the intensive care unit are COVID patients. It was 20% last week. The worry is it will get worse. Nearly 4 months ago, we were allowed inside the ICU at St. Alphonsus, at the beginning of when hospitals around the state were operating under crisis standards of care. Crisis standards ended for most of Idaho right around Thanksgiving. So we wanted to check back in to see how things are going now and how they see this next wave hitting them. It's been a little more than 3 months.
This is the main intensive care unit.
Since we last spoke with Dr. Megan McInerney.
We've got 22 beds in this unit. The majority of the patients in this unit are COVID positive.
20 of them, she told us then, were on a ventilator, breathing only with the help of a machine.
And in the unit next door is a 10-bed ICU, and every single patient in that ICU is COVID positive right now.
Safe to say, the situation at St. Alphonsus Regional Medical Center
We have 4 ICU doctors on today during the day. We would usually have 2.
has gotten a little bit better since then.
It's insane.
It is insane. A little bit. But is it as insane as it was the last time we spoke with you?
As far as in-house is concerned, no, not at all. It's different. So the numbers are increasing at a much more rapid rate in the community than anything we've ever seen. However, we here in Idaho are not yet seeing the really high rates of inpatients and ICU patients from this Omicron surge, but it's coming.
For example, the admission numbers at St. Al's for COVID patients have tripled in the last 4 days. Some even vaccinated, but often not boosted.
So yes, we are starting to see more vaccinated patients than we did previously, but it's still the majority are unvaccinated.
Which is what worries Dr. McInerney the most, with another cresting wave of COVID.
our team is bracing for this surge, and that's going to be hard.
The last time we spoke with Dr. McInerney, we caught her on a tough day.
You did. It's not that the death doesn't affect us, right? We're not robots. We all tear up, go home and cry to our family members at various times.
It was September 23rd, 1 week after crisis standards of care was activated statewide. St. Al's third floor ICU was at capacity, almost all of them COVID patients. And they were in the middle of their third code blue of the morning. It wasn't easy to be positive. Do you see the light at the end of the tunnel at all?
No.
You don't?
No. And that's heartbreaking for me to have to say. I did when I got my vaccine in December of 2020. That was my light at the end of the tunnel initially. But now I don't know where the end is.
Has anything changed between when I asked you that question and today? Do you see a light at the end of the tunnel?
I think the light that I do start to get a glimmer of is this idea that maybe Omicron is the variant that is so infectious that it will hopefully start to get through everybody and bring us out of this pandemic, right? So that it becomes more of an endemic process instead of a pandemic like we're in currently. That is some hope.
Was there ever a breaking point for you during last fall? Was there a point where you thought, this is overwhelming, like too overwhelming?
Yes, in October, when we were in crisis standards of care. So probably around the time, a couple weeks after you and I talked last time, there were moments where I felt like you can't keep doing this.
At that time, they had increased their ICU capacity by 8 more beds, a sort of MASH-like unit 2 floors below. That room was filled with patients for more than 6 weeks. But Dr. McInerney says they just kept going. She calls it an honor to work alongside such dedicated people, from the physicians to the nurses, a team that came out of the darkness of that Delta surge, but not unscathed.
We all needed a bit of a break from the surge, from Delta, which was good. We got that break. But there's a little bit of PTSD, right? When we hear that a surge is coming, again, everybody's like, oh my gosh, not again. Do I have to deal with this again?
You mentioned the PTSD side of this. Is there a resentment, though, ever among healthcare workers when they keep seeing the same kind of thing happening? The cycle of unvaccinated people coming in and requiring so much attention and help. Is there and I don't know if resentment's the right word.
Yeah, I don't know that it is. I can't speak for others, right?
Okay.
I can only speak for myself. And I wouldn't use resentment. I would use resignation, right? There's this sense of we're going to just keep seeing people who are unvaccinated show up, take care of them like you would any other patient. But it's also frustrating to acknowledge that they might not have had to come into the hospital at all if they had been vaccinated. You know, there was a period of time where I personally, would feel angry about that, but you can't. It's like stages of grief, right? You can't stay in that phase of anger forever, otherwise you just can't move forward.
And sometimes it's hard to move forward without sometimes looking ahead. That maybe this next wave will be worse than the last one.
I think it is going to get bad. I really do. I think we're going to have a full hospital again. I think we're going to have a full ICU again.
Do you think your staff, this hospital, can do that again?
I don't think we can do it the same way we did during the Delta surge. I don't think that we will have the staffing capacity to increase our ICU beds and our just COVID ward beds by as huge a volume as we did during the Delta surge.
And that would make it worse.
Right, because we would have to potentially turn patients away, and we never want to do that.
The reason for those worries, Dr. McInerney says, St. Alphonsus Intensive Care Unit wouldn't be able to handle another surge like the last one. Staffing. The burnout rate with healthcare workers has been high over the past year and a half, and you can't just pull ICU doctors and nurses out of thin air. Plus, with this variant so contagious, it's running through the vaccinated staff as well, and they all have to take time off to recover. Dr. McInerney says the hardest part of being the ICU director is keeping that positive outlook. Before Christmas, she sent out an email asking staff to sign up for extra shifts, knowing this surge was coming. I asked Dr. McInerney where she anticipates things will stand 4 months from now. Kind of on that question we asked before, she doesn't know where that end is, and she told us she doesn't have any way of knowing. We could see another variant coming down the pike, but she hopes Omicron will be the one that pushes us out of a pandemic and into a seasonal endemic, as you heard her say. There's one thing she does know, however. There's a sign in the hallway of the employee entrance at St. Alphonsus that last September highlighted the 2,400 COVID patients St. Alphonsus sent home recovered. Because of continuing to show up, just doing their job and supporting each other every day, nearly 4 months later, that number is now more than 3,000. And they will keep doing that, keep adding to that number to the best of their ability, no matter what wave rolls into Idaho. Dr. McInerney stresses the one thing that will make their job easier: increasing COVID vaccinations. And it's not just hospitals seeing more COVID patients. Last week, a record breaker for primary health, not only in regards to visits, but also the number of staff who've had to call out sick and are isolating at home because of it. On Wednesday, 65 of the company's 600 employees were out. Today, that number is 85. That's almost 1/6 of their workforce. CEO Dr. David Peterman told us last week if they continue to see trends like this, they're going to have to start closing clinics, and they have. As of today, 3 of Primary Health's 21 clinics are closed. They actually closed 4 last week, but they were able to open one back up. All of the locations now close at 7 p.m., an hour earlier than normal to give time for employees to get other things done, and also give them some time off. Unfortunately, the records don't stop there. Dr. Peterman says in their clinics alone, the positivity percentage in kids with COVID has risen 10% in the last week. They're seeing positivity rates at their clinics hitting 34% overall. And again, cases alone aren't as big of a concern as what they could lead to. And so far, that has led to staff shortages, closures of clinics, and a limit to medical care access. All right, a little less than a minute. Let's get to your comments, like this one from Gene in Nampa. On the budget surplus, when your children are starving and your house is falling apart, you don't get to brag about how much money you have in the bank. Feed the kids and fix the house, Gene says. Got a lot of comments on the Let's Go Brandon comment from Representative Mike Simpson at the governor's dinner this weekend. Brian, during the Trump administration, Democratic elected officials encouraged active confrontation with administration officials. Do you think this phrase by Simpson is a worse infraction? Another email sent to me today, just a few moments ago, said, far worse things were said about Trump for 4 years from media and Democratic politicians. Please show me where you devoted a 2-8 segment castigating that. Were any of them said by Idaho's delegation, I guess is the question we ask, because that makes it a little bit more important, I believe. Following right along with the rest of the media world, blowing up a small moment and trying to make it into something sinister. I don't care what side you're on. Relax and learn to laugh, I guess.